Practical Medicine, Splinting and Casting by Senior Clerk Concepcion. Materials needed are measuring tape, bandage clip, bandages, splint, stockinette, and pillow. Position the patient. Before splinting, make sure to prop the patient's leg up with a rolled up pillow underneath the knee to ensure ease of splinting and the patient's comfort. Measure the leg. Measure out the splint length needed using a measuring tape. Measure starting from 2 finger breadths below or distal to the popliteal fossa, following down the back of the leg, ending at approximately 4 inches or 4 finger breadths past the toes. Keep the measuring tape taut as you go. Cut the appropriate size splint. Soak the splint in warm water and remove excess fluids before using. Place the stockinette. Put the stockinette up the injured leg. This will serve as the first layer of a multi-layered compression bandage to protect the skin from chafing and keep the leg dry and clean. In applying the stockinette, pull the proximal end of the stockinette up until under the patient's patella, with the distal end well past the patient's toes. Smooth out any wrinkles. Apply the splint. Brace the patient's foot against your body to stabilize the leg as you splint. Keep the foot flexed at a 90-degree angle. Starting 2 finger breadths below the popliteal fossa, apply the moistened splint following the contour of the patient's leg. First bandaging. Begin by wrapping the first bandage from below the knee, keeping it snug but not too tight. Wrap the bandage along the whole length of the leg until the ankles, making sure to use the whole length of the bandage. Second bandaging. Begin wrapping the second bandage starting from the dorsum of the foot in a figure 8 pattern. Wrap around the heel and the folded part of the splint, making sure the toes stay exposed. Secure the bandage in place using clips. Third bandaging. Roll the excess end of the stockinette by the popliteal fossa over the splinted area. Wrap the whole leg with the third bandage, making sure it's applied securely and comfortably. Check the foot. Inspect the foot by assessing the toes and ask the patient for any pain and if the sensations are intact. Assess the splint by running your hands over the sides, checking for contour, rough edges, and proper molding to the patient's leg. Thank you, and please subscribe to my channel.